alopecia, followed by the presentation of Dr. Tessauro from Milano on micro and nano fat in treating different hair loss conditions. Then we're going to hear from Dr. Ramon Lu, who is actually a board-certified plastic surgeon from Mallorca, Spain. And he's the first president and one of the founders of the International Federation for Adipose Therapeutics and Science, the IFAT Society. He's going to talk on common myths about stem cells, fat grafting, and nanofat. And that's going to be followed by my presentation on the stem cells for hair loss, the good, the bad, and the ugly.
Thank you.
Yes.
So I'll be talking about the role of exosomes in the management of androgenetic alopecia as part of the stem cell workshop. I have no financial interest to disclose. So the action of reversing the pathological mechanism of androgenetic alopesia is based on secreted bioactive factors, including growth factors and cytokines, with which to induct hair follicle stem cells in their native niche. So stem cells secrete these factors to trigger host site damage repair cascades via paracrine effects. A secretome consists of all the factors that are secreted by stem cells into the extracellular space, including proteins, extracellular vesicles, and nucleic acids. A conditioned medium is the nutrient medium where stem cells are cultured and contains an abundant secretome. Exosomes are a specific class of phospholipid extracellular vesicles with a diameter of 40 to 120 nanometers. Exosomes contain functional DNAs, RNAs, proteins, and lipids that have regulatory effects on recipient cells. They carry hydrophobic Wnt proteins on their surface to induce the activation of beta-catenin, which is a key signaling pathway involved in the regulation of hair morphogenesis and regeneration. So this is electron microscopy of a cup-shaped exosome. So dermal papilla cells regulate outer root sheath cells, which are key regulators of hair follicle development and growth. And dermal papilla cells exert their regulatory function of hair follicle growth mainly through a paracrine mechanism and various factors to modulate mesenchymal epithelial interactions, including epidermal growth factor, transforming growth factor, beta, and keratinocyte growth factor. So exosomes in vitro studies, the properties of exosomes were first noted in studies using stem cell conditioned media, and it has shown that in these studies that there's an increased proliferation of both dermal papilla cells and epidermal keratinocytes, and enhanced proliferation of these cells was associated with increased expression of genes associated with hair growth, such as transforming growth factor beta, noggin, ERK, and AKT. In vivo animal studies, there is a study using intradermal injection of mesenchymal stem cell derived extracellular vesicles in treated mice compared to non-treated mice. There was an increased progression from telogen to anagen phase, so there's an accelerated anagen onset. There was a prolongation in the anagen phase in the treated mice compared to the non-treated, and there was a delay in catagen. So this data suggests that exosomes have the ability to promote hair growth and hair regeneration in an accelerated state. This is another steady regulation of hair follicle development by exosomes derived from dermal papilla cells. So exosomes derived from dermal papilla cells, treated hair follicles had the characteristic anagen phase, thicker skin, and a larger hair bulb with increased melanin contact and more bulbs present in the subcute. In contrast, phosphated buffered cell line in the controlled mice exhibited the morphology of an earlier anagen phase, and the most bulbs were present in the dermal subcutaneous layer. So skin thickness and bulb diameter as well as hair cycle scores were higher in the exosome-derived dermal papilla cells treated hair follicles of mice as compared to control mice. So in this study, Exosomes stimulated the expression of beta-catenin and sonic hedgehog signaling, which regulate hair follicle development. So when beta-catenin signaling modulates inductive signals between the hair follicle epithelium and mesenchyme, regulating hair follicle growth and induction, and maintaining the anagen phase and hair cycle regeneration. Sonic hedgehog signaling is a prerequisite for paracrine signaling and regulates hair follicle cell proliferation and formation and the initiation of anagen. So injection into hair follicles in the telogen stage accelerated the onset of anagen, whereas injection of hair follicles during the anagen delayed the catagen phase, which results in producing longer hair shafts and larger bulbs in mice. So these are a number of studies done over the past 4 years on stem cell derived extracellular vesicles for hair regeneration. Only one human study to date, 20 patients with androgenetic alopecia, received a single injection of exosome treatment. Hair density and thickness was measured at baseline and 12 weeks. Exosome therapy increased mean hair density and increased hair thickness compared to baseline. There was no reported serious side effects. So this is before baseline. After 1 month, another patient at baseline, and at 3 months, you can see an increase in the hair growth. So the advantages of exosomes, they encapsulate therapeutically relevant molecules, which are proteins and nucleic acids in vesicles, and they protect them from degradation. They're more stable for large-scale production. They retain the ability of homing and being internalized by the target cells. Exosomes are present in cultured media, as we know, but the content is not high. So there's a need to develop more effective methods to isolate exosomes from cultured media, which balance both efficiency and purity. In terms of the risk of exosomes, the US FDA issued a warning about the use of exosome therapy because there's fewer than 5 patients in Nebraska developed severe infections, including sepsis, after receiving unapproved cell-based therapies, including exosomes derived from C-section placenta. So the FDA advisory highlights the need for clinical trials to appropriately test the safety and efficacy of exosomes. Exosome therapy in my practice. So there's a Korean-based exosome therapy previously approved in Korea, which has recently been approved by the Saudi Arabian FDA. A female patient with early AGA female pattern hair loss received 3 monthly sessions of exosome therapy to the affected area, which was applied using a derma pen at 1 millimeter depth. After 3 months, you can see an improvement in the Sinclair scale at the central parting here. There was also improvement in the temples when looking at the side views. So there's a clear improvement in the temples here after 3 months post-treatment. So in summary, hair follicle growth and cycling is regulated by a paracrine crosstalk between epithelial and mesenchymal dermal papilla cells, which is disturbed in AGA. Exosome therapy promotes hair growth by providing signals needed to reinstate or initiate mesenchymal epithelial crosstalk, leading to restoration of miniaturized hair follicles and follicular neogenesis. Clinical trials are needed to determine the best way to manufacture and apply exosome therapy for the treatment of androgenetic alopecia. Thank you.
Micro and nanofat in treating different hair loss conditions. This presentation is done by Piero Tesauro from Italy, President of the Italian Society of Hair Science. Autologous fat transfer is a powerful tool with extensive application and a brilliant future. And from our point as a surgeon in this field of hair restoration, we can see the primary effect and also the secondary effect on the hair regrowth. FT is an incredible story of reverse application of something that we learned many years ago. We understand how to reuse the fat for volume defect, and we observed that the fat tissue did more than we expected. The tissue function was completely new, and we started learning which cells carries the function. The application in hair restoration was were clear since the beginning, and we use for scars, we feel the volume defect and we perform the operation. At the beginning, it seems for us just a new transplant opportunity, but then we realized that the new tissue function led us to better results. Of course, not all scars are equal, and so we have to do a proper selection. Normally, the selection is very easy, just touching the patient or using a needle to understand how that is the tissue. Sometimes we can need echography or biopsy. Small scar seems immediately to me the perfect indication, and I want to take advantage of the virtual conference because